Well, thanks everyone for coming. We are from Excel Physical Therapy. I'm Jason. This is AJ. We have our little intro slides here in a moment. But with Excel Physical Therapy, we're really interested in giving back to the community through education. So we do community education seminars several times a year. We did some this fall with ski-themed seminars, as well as one on jaw pain. And then we're doing this one tonight. And then June 4th, our pelvic health division is doing one on pelvic health and postpartum and getting back into exercise and things of that nature. And that will be at our Excel clinic off 19th in College. But I'm going to turn it over to AJ first, since his intro slide is first.
Yeah, starting with the youngest first.
Yeah.
I like to remind Jason I'm younger than he is. Maybe. All right. Yeah, I'm AJ Sobrilsky. I've been a PT at Excel for almost about 6 years now. From the Midwest. So just a bunch of titles I have to make myself feel important and get people to trust me. But I recognize a few faces and everything in here. But yeah, I mean, both Jason and I are big outdoor people, skiers, runners, big into cycling. We both do the bike fits. I also coach a lot as well. So kind of being able to see the person or the patient from chasing goals to getting back on the bike, whether it's from injury and everything like that. I think, myself and Jason both have a pretty broad spectrum of meeting everybody where they're at and trying to get them to where they want to go.
And I am Jason Lunden. I'm a PT, obviously, as well as board certified as a sports specialist. And I've been with Excel for 15 years now, and also am an owner with Excel too. I'm really enjoy doing things outdoors, especially with my family. So I'm really involved with NICA, which is a middle and high school mountain bike league. Gall's on our race staff as well. And then in terms of clinically, what I like to do is I really geek out on looking at how people move. And if they're in pain, if we can change how they move, if we can get rid of their pain. So bike fitting in this instance is the perfect way to do that. So there's a lot that we'll cover here in a few minutes of things that we can do. Is if you're having pain on the bike, we can often change your positioning on the bike to reduce the pain or eliminate the pain while you're biking.
Go for it. So, like Jason alluded to, why are we here and where are we going? So some of the big things we're going to really dive into tonight is understand why injuries happen, both from like a very global aspect and then on the bike, why they happen. How you guys can take away some actionable strategies to prevent or mitigate or also manage maybe some things you're dealing with on the bike or things that are keeping you from doing the riding you want to do. And then give you some tools, exercises, tips, maybe some fit modifications, or at least a strategy to go about potentially working through an injury you might have, or if something came up, how to start handling that. And yeah, why are we having this talk? Well, injuries happen, and really, whether it's skiing, mountain biking, running, it's usually not a matter of if, but when. Okay, and the reality becomes is like, if you have an injury, when should you start addressing it? And the analogy I like to use is, when do you start to address your leaky roof, right? You don't wait until the whole first floor is flooded and you can't even use it. It's the right time to address it, and we'll get into a little bit more, is being very liberal with that definition and getting ahead of it, because usually jumping or modifying for a week or two will save you a month or two down the road. And so that whole 1 ounce of being proactive really does equal a pound of protection here. And what you're going to see, and I think we've already heard it once kind of in here tonight, is like a lot of the themes and things we're going to talk about are going to be simple, but that doesn't mean they're easy. Again, everybody's injury, their situation, their life, it's always complex, it depends, and it's never fun. So when we look at cycling injuries in general, go ahead and you can maybe. Sorry, I got a little bit of an animation here, hopefully. Keep hitting it once. Anyway, predominantly we see patients for knee pain, low back pain, thigh, so just leg in general, and then in the shoulders. So again, those are what we typically see. I would also add a lot of neck pain in on this, and also some wrist pain. But when we look at why cyclists typically seek out care, these are where we see them. And then in a study of actually professional cyclists, so yes, like even people who get paid to ride, you can advance it if you want. They also report the prevalence of injury Specifically, if that dark black line is low back pain and the light one is knee pain. So in professional cyclists, they're reporting pain primarily in those areas, and then it's divided into when they typically have increase in injury or symptoms. So off season, preseason, early season, and peak season. So we kind of see as intensity, volume ramps up, the prevalence of injury goes up, which makes sense. But this also goes to kind of show that almost 50% of cyclists, again, even if it's their job, are reporting some degree of injury and symptoms. So again, you're not alone. And when it comes to like what an injury is and why we have it, there really is just one simple truth, okay? It's a imbalance between our tissue's ability to tolerate the load or the activity we're putting on it, so cycling or a position, and its current capacity. And when we exceed that load exceeds our body's capacity, we either stimulate a change, but when it goes on long time, it kind of, I like to say, the bucket starts to overflow or it leaks, okay? And that's when we start to have reactive responses, okay? And in order to change that excessive load on the tissues, we need to find a way to reduce the load, i.e. modify training, change the position on the bike so we can offload some tissues, or we can also increase the tissue's capacity to tolerate that load via appropriate training methods and or specific exercises. And so again, why are we getting injured? And really we can kind of break this down into the big three, and honestly the majority of them is typically in this load management bucket here. And so when I don't know how many people use like a Training Peaks or a different training thing, but this is what high-level sports scientists are looking at when we're looking at an athlete's training data. Sleep, strength, power, how much load, when's it come up, when's it come down, for each and every different day. And we're trying to balance these loads and tolerance so we don't have these big fluctuations. So it's really finding the right recipe for the demands and or the stressors in your life or the training in your life, all right? And then combine that recipe of the right stress and the right rest with specific ingredients. So your tissue mobility, your strength, your position, your fit. So we have those right ingredients. And then really it becomes kind of playing a little bit of offense. And this is a quote I have here from a really popular coach that does a lot of really good work. And when he talks about coaching his athletes, he really speaks to, it's really not about giving him the fancy protocols or the really hard workouts or like anything crazy. It's really just trying to keep them from doing dumb things. So I haven't ridden my mountain bike all year. Sounds like a good time to go ride the Bangtail, right? So, we kind of got to put those right pieces in play. So.
And so a big part of that is cycling in general is a pretty forgiving sport. It doesn't put a lot of load through your joints or through your body right away. It's more of that cumulative load that occurs over the course of a really long ride or ramping up to a really long ride too quickly, as AJ alluded to. And that's where the form or the fit comes in, because you can get away with a pretty poor fitting bike if you're just doing really short rides. But as you're going on longer and longer rides, you're getting that cumulative load on there. So that's where the bike fitting piece comes in, and really looking at your posture, your form on the bike to change where that load is being distributed while you're riding. And so bike fitting is different than bike sizing. So bike sizing is when you're going to come into uphill and see Dan, and he's going to sell you a nice bike and get you on the right sized frame. But everyone is going to be a little bit different. We're going to, someone who's 5'10" may have a different inseam length than I do and different torso length. So they're going to be, on maybe a medium or a large size bike, but the reach is going to be a little bit different for me versus someone else. And that's where the bike fitting comes in, where we really want to try to individualize the fit of the bike as best we can to the person in front of us. So we do a lot of things to look at and change that. Yeah. So again, bike fitting is really merging the person and the bike with a real emphasis on making the bike fit the person and not the person fit the bike, so to speak. And so in terms of what actually happens when you come into Excel to get a bike fit is we go through a subjective history or interview and figure out, what's causing you pain while you're on the bike. What's your training history been just prior to that? Are you the person who got really excited on the first really nice day of May and hasn't been riding all winter, just been skiing all winter, and then you decide to go ride from here up to highlight, go as far as you can, come back, and then do that a couple days in a row. And lo and behold, now you're starting to have some pain. So we also really want to gain insight into what's your training history, because as AJ mentioned, that's a big common denominator in a lot of injuries that we see, particularly in endurance athletes. So we take that time to understand, to try to get a better understanding of why the injury occurred. And then we often will just get you on the bike, get you warmed up on the bike. We'll put your bike on a trainer, so you're bringing your own bike in, and then start looking at your form or your posture on the bike, and then start changing things to get you into a better form on the bike, and ideally have those things that we're changing cause you to have less pain. And then if we're still not quite where we want to be, then we get you off the bike and start looking at your body in terms of, what's your flexibility, what's your strength like, and are those things contributing to your ability to have a good fit on the bike. And so for most bikes, you're going to have 5 points of contact. Okay, you have your feet on the pedals, your butt on the saddle, and then your hands on the bars. If it's a TT or a tri bike, we have 2 more points of contact where you're in the aero bars on your elbows as well. And it's those contact points where we can really influence what your posture is on the bike by changing where those contact points are. So the 3 big things that we're looking at is your foot position on the pedal. If it's a platform pedal without a cleat on it, there's not a lot we do. We just kind of educate you on where we think you should have your foot, but typically it's not going to stay in that place. If you have a cleat on the bottom of your shoe, we can get your foot aligned right where we want it to be and have it stay there. So that's a big part of the process that we're doing. Probably the biggest fault that we see is saddle position in terms of saddle height, as well as the fore and aft position. So how far forward is the saddle towards the bars, or how far back is it away? And then a real big thing is the tilt of the saddle, which most people don't even think about. How level is your saddle compared to the ground? And those are things that we really spend a lot of time looking at. And then finally is the handlebar position. So both the reach, how far the bars are away, as well as the drop of the bars compared to the saddle. How upright are you, or how far down is it? And so we spend a lot of time on that if necessary, with putting on an adjustable stem on your bike so you're using your same bars, and then really dialing that in, and then sending you back to uphill to get the correct size stem that you need, rather than just saying, oh, I think you need a shorter stem, and you having no idea what that means. So as far as troubleshooting in terms of if you're getting pain on the bike, where is the problem likely to be in terms of what can you maybe start doing on your own before you can get in to see AJ or I, is the saddle. If the saddle's too low, that just means that your knee is going to be a lot more bent throughout the whole pedal cycle. And so it really increases the compression at the patellofemoral joint, or your kneecap. And patellofemoral pain, or kneecap-related pain, is the number one type of knee pain that you're going to get in cycling. And in those studies that AJ was showing earlier of professional cyclists, knee pain is actually the number one time loss injury for cyclists over back pain, which is a little bit surprising. So knee pain can really derail your training as well as your ability to perform. Also, if that saddle is too low, it can also put increased stress on the muscles. So your quads are a big generator of power while you're on the bike. And if that saddle's too low and your knee is too bent throughout the pedal cycle, it's not optimizing what we call the length tension relationship for that muscle. So it's working harder than it needs to. So that, again, can be another cause of knee pain on the bike. If the saddle's too high, something that we don't see as often, you're going to basically be reaching with each stroke at the bottom of the pedal stroke. So you're going to start getting your pelvis rocking back and forth. And that can be a cause of saddle area pain from getting saddle sores from that. It can also be a cause of IT band or lateral knee pain on the outside of the knee because of that reaching with with how you're doing that with your pelvis as well. So that's what we typically, if you're having pain on the outside of the knee, we're generally going to lower your saddle. If you're having pain on the front of the knee, we're going to raise your saddle. If the saddle's too far forward, that also is going to cause your knee to be bent more than it needs to be throughout the pedal cycle. So it acts a lot like the saddle being too low. And then if the saddle's too far back, which isn't listed on here, that's actually going to increase strain on your hamstrings. And so if you're having posterior knee pain, a lot of times your saddle is too far back. So we're going to slide it forward on the rails. And then lastly, when talking about the saddle, with talking about that tilt or the levelness of the saddle, when we quantify it by the nose, so we would say a negative tilt would be nose down, a positive tilt would be nose up. If your saddle has a positive tilt, it locks out your lower back, and that's a real common reason for having lower back pain. If the saddle's tilted down too much, you're sliding forward on the saddle, so it's putting undue pressure in the saddle area. So that can be a common cause of saddle area numbness, which will carry over into other activities in life that you typically want to continue to be able to do. As well as it will put too much pressure on your hands and can be a common cause of wrist pain as well. All right, and then the stem and bars. So if the reach is too long where you're Supermaned out this way, that's going to put a lot of increased fatigue on your upper back and neck, just because you're not as in stable position with that. If the stem is too short, meaning the cockpit is too short, you're going to be forced to have to curl through your back to hold that position. So that would be, in my experience, the second most common cause of low back pain. And then, okay, stem too long is on there twice. So if the stem's too low, that often will cause you to have to curl forward too, because especially if you don't have the length in your hamstrings or the flexibility in your hamstrings, you're going to have to compensate through your back to get to that lower bar drop. So again, that typically will cause back pain.
So Jason highlighted a lot of the on the bike aspects that might be contributing or need modifications or adjusting. But one of the things Jason and I are both pretty adamant about is that it's not like one or the other, it's an and thing. So the things we do on the bike need to complement the things we're doing off the bike to support that whole kind of game of circular causation. So yeah, really what we can do here with a professional bike fit is kind of really dial in that recipe, basically bringing a really good chef in, kind of helping us figure out what needs to go where, when, and how. And what I liken that to is positioning the cannon and building the canoe. So again, if we are looking at a bike and we have all these places specific that we're essentially anchored, if we can get you in the right position over the pedals, it creates a much more efficient rider. Again, it helps with delivering the load. Again, if we think about shooting a cannon from a canoe, right, that doesn't go very well. But instead, we want a really solid base, aka our trunk or our core and our position on the saddle, so that we can deliver direct power over the pedals, which again also allows us to deliver that stress and strain appropriately through the joints there as well. So when we look at the physical attributes or the necessary ingredients to, be as injury-free as possible, riding as efficiently as we can, we want to make sure we're appropriately delivering force, making sure we have appropriate posture, and then we're really individualizing that to each person's skeletal symmetry, right? So Jason was talking about everybody's got different inseams, torso lengths, different slightly, we would call it anaversion or retroversion, or how your hips sit or twist. That all kind of dictates how we modify unique specific things to the bike fit. And then I would liken a lot of it to playing offense. So we know that cyclists require specific amounts and specific areas of mobility, the low back, the hamstrings, the quads, right, to go through that pedal stroke. We know they require a specific amount of stability, again, usually on the seat and through the pedals where we're supporting ourselves so that we're delivering as much force through the pedals efficiently and well as possible. And then strength. Again, the stronger we are, our tissues are, the more force we can deliver, and then the more they can tolerate. So strength is also a thing that allows us to tolerate more of the activity that we like to do. It's essentially a bigger bank account. And so for those specific things here, I have a couple of the very, very common things we are using and giving out to patients. So one of the things I like to do, especially for the low back, is that one up there on the left. That's really working that anterior hip flexor. So as cyclists, we spend a lot of time here and or in our life sitting. And so that can kind of draw that hip and that pelvis down, creating that essentially that opposite of the arch. And then when we get off the bike, we're not very open. So it's a good way to kind of help work a lot of that lumbopelvic area and that mobility. Same thing with that foot up. It's just a little more aggressive to that quad or that hip or that thigh area, which will also help relieve some of the compressive forces at the kneecap if we have a little bit more mobility through those tissues. Right down here, we're starting to work a little bit of that posture and that form that Jason alluded to earlier. So I can't quite tell, but I have a dowel and a broomstick here, and I'm sitting on my saddle with the pedals roughly level, and I have the back of my head between my shoulder blades and my sacrum essentially in line on the left side. And then that lower picture, you can kind of see how my lower back is arched or rounded, okay? Kind of pulling away from that, not having that good, what we would kind of almost call a neutral position. And then I'm also kind of working on it and re-educating that posture, that position off the bike. Now, every time I talk about this, everybody raises their hand and they're like, yeah, but every professional rider is like, the St. Louis Arch, right? And I mean, you're absolutely right. But if we bring up those stats again, 50% of them are reporting back pain. It is their job to cycle, right? And they've been cycling 6 to 8 hours a day for the last 12 to 15 years of their life. And so they've kind of adapted slowly over time to those things. And so that's why they ride with the bars slammed and they can ride in those positions. And they're undoubtedly changing their position and on and off the bike depending upon the demands of which they're supposed to be doing for that race. So I get it, but most of us would probably benefit from riding a little longer without pain than worrying about a couple watts dragging with the wind in our face. And then just a little bit of stability work. Again, I like doing a lot of things on our hands, again, because we're typically, stabilizing from our upper extremity and our lower extremity. And the big thing here is maintaining that, I'm going to call it stable, neutral back. And you might not be able to see it, but I have a little bit of a red line here. And I'm working just slowly lifting different legs and in different, or arm and leg in different positions to control that twist and or that rotation here so that we can make sure that, again, this is stable so that we can deliver force and be comfortable but also efficient. So again, like I alluded to, injuries are going to happen. How many people in here have never had an injury in their life? Perfect, see? So the question is, what do we do when we get an injury? All right, I kind of like this Mike Tyson quote because we're never really like wanting one to happen, but we're always gonna have to deal with one. So what do we do when we get one? Go ahead. So really, I think most people should be more liberal when they are defining an injury. And again, in most sports science, is any pain or issue that takes away from regular training activity. Now, Jason and I will both tell you that most of the people we see, most are well beyond that definition and usually requires a more significant amount of modifications to their activity and usually takes a little longer to get them back to where they want to. So again, if you start to notice your roof is leaking, you're not going to wait to call the plumber or whatever until, again, the whole first floor is flooded. So if we're a little more liberal, you get in to see us sooner, we have to require less time away, we get on to things right away. Again, you can see where I'm going. But really recognize those earlier signs. So we're having a reactive response. The knee, you climbed a lot of pylite, your knee's a little more sore than it used to be. After a while, it's getting sore, it's tight, it's like, what's going on here? Again, maybe it's taking you longer to recover. That's a sign that our body is not adapting well to the stress we're putting on it. Again, extended soreness and fatigue. If you're training, you're feeling like, man, I can't keep up with what my coach has written down or the rides I'm supposed to be going on. Again, that's telling you like, we're not tolerating the demand. Something's going to start to overflow, and usually it's sickness or illness. You're just not psyched or stoked or psyched. That's what I see with a lot of athletes. You're just not excited to get out. They're kind of like feeling burnt out. Something's getting cranky. And if you're more into the techie side of things, HRV, training stress score, or training load ratios. So again, a little bit further than we need to go. And these here, it's really easy to pick on runners, and most cyclists are runners in recovery. And so you can kind of see that just kind of everybody's like, yeah, but the group ride, or I got this, so get in there earlier is really the big takeaway of this slide. But if you are having complaints, and these are things that, again, we would talk about at PT, this right side here, this peace and love, is more about like acute injuries, things that maybe, you put a foot down and rolled your ankle, or you fell and you maybe twisted your knee. This is what we want. This is the updated RICE, the rest, elevate, ice compression. That's kind of, we've gone away from that. We're moving into this peace and love, and the peace and love stands for protect the tissue. So again, modify activities, don't do anything crazy to it. Some elevation will help with some local swelling. Avoid anti-inflammatories. Okay, this is one I kind of have to remind myself as well sometimes. We'd like to compress it too. That will also help with a little bit of that swelling control and or also a little bit of pain. For us, we educate you on what's going on. Again, some of these peace and love things. And then the love is load. So injuries don't heal by just resting them. Okay, load builds load tolerance. So a lot of people are like, my knee hurts, I'm going to stop riding for 3 weeks, and they jump back on the bike and it hurts again, right? And it's really just this diminishing capacity and resilience by going away from the activity. So one of the things we're really good at is getting people to maintain as much activity as possible without going to complete zero. In fact, going to complete zero pretty much sets you up for a sooner injury, whether it's in the same area or a different tissue, because we're losing capacity. Be optimistic, okay? There's really no injury somebody hasn't come back from, mostly. We want to get some blood flow there, so vascularization, and then really maintain any and all exercise abilities that you can. And then when we are working through an injury, this is just kind of a general pain model that we tend to use for most soft tissue-y kind of things, so tendons and muscles, but some pain is okay, okay? You usually tell people 2 to 4, 2 to 5. If it's more than that, then that's kind of that red zone, time to stop or modify the activity. But as long as it's no worse the next day and you're no more sore than prior to, that's kind of cooking things at the right temperature. For a lot of things, we have to feel it to heal it. Again, that's not saying just beat it to death and ignore it, but it's respecting it, making the right modifications, kind of watching the patterns and the trends of the symptoms. Get there. So again, training modifications, if something starts to happen, assemble your team, whether it's your coach, your PT, sports psych, nutritionist, get everybody involved, because we're going to be able to figure out the right plan to keep you going. And in the short term, adjust acute training variables. So the easiest go-to just for prescription-wise is usually if something comes up and it's bothering you from doing your normal activity, cut the volume about 30 to 50% and see how it responds from there. Start to look back 2 to 3 weeks. Most injuries have been kind of brewing underneath the surface. It's kind of like the iceberg that you can't see. And usually you're looking for changes in your riding activities in the previous 3 to 4 weeks. All right, so again, first day of spring, highlight once, knee hurts, let's look back, nothing. Okay, that makes a little sense. And then we really want to make sure we keep the ship afloat. So that doesn't mean, again, don't go to zero. We can find ways to make sure you're staying strong, doing some form of riding, some cross training, some mobility training, so that you can keep your body getting better while we allow the other tissue to recover, and so that when you are back on the bike and that tissue's ready, you are more resilient and ready in the long term. And so how can we help? Well, really, again, that Jason and I can help assess and develop those individual plans via those kind of steps we went through. We can help you take care of those small injuries via, looking at mobility, strength, or, stability, symmetries or asymmetries. And we feel like we can get you back on the bike probably sooner, just because, again, we're feeding you and the right things. But again, if worse comes to worse, you take a bad spill, something breaks, something hurts. We're there to kind of get you through that phase and then usher you onto the bike as quickly as possible and get you back into the point where you're riding right away. So if there is the surgery aspect, or maybe it's a ski thing, we can help bridge that gap for you. I think we got one more, or unless you want us in there. All right, so the big injury recovery insights: stress plus rest equals growth, okay? We only get stronger when we allow ourselves to recover from the stimulus we gave it. So everybody likes to forget the rest side of it, and they just go stress, stress, stress. Prevention is proactive, not reactive. Recovery always takes longer than we expect it to. It doesn't matter, again, if you're a professional or a weekend warrior. It's always going to be longer. Consistency and persistency is important through that whole recovery process. And really consider all areas of stress, not just the stress in the activity. So life, sleep, diet, all the things can kind of fill that bucket to the point where maybe it overloads. And then really when you do have an injury, be optimistic about it. Experience it as like an opportunistic mindset. So it's not an obstacle, but more of an opportunity to grow or pursue things that are slightly different. And then really have a team on your side. Know who to call, know who to go to, kind of help funnel that so you can get back on the bike sooner. Nah, you're good.
Cool. So, our whole purpose of this is to hopefully prevent you from having to come in the clinic. We truly, Bozeman is a great place to be a PT. If you haven't noticed, there's a PT clinic on just about every corner, because everyone's so active and everyone wants to get better. And unfortunately, with a lot of the activities we like to do, injury is just bound to happen. I'd say probably one of the biggest takeaways, if you're like thinking, should I go into physical therapy or should I go see someone or not, is the earlier you get into someone, usually the quicker the rehab is going to be. If you've been dealing with it for 6 months, it may take several months to get over it. And so, really trying to look at that and be more proactive, not only with trying to prevent injury, but dealing with an injury too. And really take to heart that peace and love analogy that AJ was saying, where we're not trying to fully rest until the injury is healed, because that has just led to a big increase in the chronicity of injury, especially tendinopathies like Achilles tendonitis. And like, I'm sure some of you know someone who's had Achilles tendonitis and how long that takes to recover from, because usually popping Advil and resting on the couch is the exact opposite thing you should be doing to heal that injury. But we'd be happy to take any questions at this point. Yeah.
When you're fit like a road bike versus a mountain bike, how do you go about that? Is that the positioning quite a bit different, I would assume? And then I just
Yeah, good question. So the question is, the differences between fitting your road bike versus your mountain bike. It used to be a lot bigger differences before the advent of dropper posts. But with the road bike versus the mountain bike, your cleat position is going to be very similar, as well as the saddle position. It's just the cockpit is going to be different. So almost without a doubt on a mountain bike, you're going to be in a more upright position. And these days, with the stems being so short, we're generally not even addressing the stem length, because with the adjustable stem that we have, it only goes down to 50, and mountain bike stems these days are much shorter than that. We will adjust the height with either looking at a stem with having more of a rise on it, or if you have spacers from when they cut the steer tube, we can play with that too. With a road bike, we're going to be generally diving in a lot more on that cockpit position and handlebar position. But again, as far as where the saddle is and where the cleats are positioned, it's going to be essentially the same. The one thing where it may differ is where we're looking at your stance width with the cleat. The bottom bracket width is going to be more narrow on a road bike versus a mountain bike. So you can't just transfer your road shoes to your mountain bike shoes and get away with it.
Just to follow up with that, then seat height, because of the dropper post, do you usually set that your seat height then at like the tallest? Is that where you usually set that for like climbing?
Correct. Yep. So we set the seat height on a mountain bike. So dropper post, for those of you that aren't familiar, is when you're riding, you go ahead and put it up. You can adjust your seat height on the fly. And that's really helps with mountain biking for handling, especially with descending. And so when we're setting your seat height, we're going to set it at the highest setting for when you're climbing or when you're on more level terrain, and then not worry as much about the lower. When we're setting your cockpit up with mountain biking, we're going to set your brake levers when you're in the descending position. So with the seat dropped, and then you getting into your descending position, because that's when you're going to be using braking force most often. Yeah.
I tied into that a little bit, but earlier you were talking about the fore-aft saddle position and how that engages your muscles differently, right?
Mm-hmm.
So tri-bike, where your knees are probably like in front of your pedals, right?
Yeah.
Compared to maybe let's say a really relaxed geometry mountain bike, is there like a rule of thumb that you shoot for when you're, or any advice on adjusting 4F saddle in those two extremes?
Yeah, great question. So the question is, again, thinking about the forward, so you can slide the saddle forward or backwards on the seat post. And what Dan was referring to is on a TT or a tri bike. So that's the one where you're all the way forward and you see them with like the wind tunnel helmets on and stuff. That is purely built for just generating power and generating speed. It's horrible at handling. And so you're sacrificing handling a lot on that and the position on the bike to just really try to maximize the power that your glutes and quads can generate. And for that reason, the saddle is going to be set further forward on that. And so the way we typically will measure the saddle fore aft is having you stop at the 3 o'clock position, the forwardmost position in the pedal cycle, and then dropping a plumb line off the knee and seeing where that plumb line, or basically seeing where your knee is in relationship to the end of the crank arm or where the pedal is going into the crank arm. There's a pretty wide range regardless of what type of bike you're using, but if you were to come in with your mountain bike and then you also came in for another appointment for your TT bike, because I've had people bring 6 bikes before for one appointment, which is just too much. So we set up other ones. Your saddle fore aft position would definitely be different. You'd be in a much more forward position on that saddle for your TT bike and a much more rearward position for your mountain bike.
Yeah, I would say one thing with the difference both mountain bike, road bike, tri bike too. I've noticed at least a trend, and when I'm changing mine is the road bike you're in a much more consistent position, right? And so it's a longer stress on tissues for a long period of time. So it's not so much that the position is bad or non-optimal. It's just your tissues aren't ready to tolerate time in that consistent position, right? Because think about mountain biking, you're up, down, you're moving a lot, right? So there is a little bit of, sometimes I will nudge the seat down slightly on a road bike just to kind of help get a little bit more there. But with what Jason was mentioning on the fore aft on the bike for the TT, a lot of it will depend on your history and injuries as well. Like, have you been dealing with knee pain? Have you had any issues? But we can also start to consider, again, he talked about reach. Like, I'm a very short torso person with a long femur. And so I can't be out here and then also have my foot behind. So there's a lot of these, we call anthropometric measures, like limb length aspects that to consider as well, to like, I call it circular causation. Like, if you move one, the other moves kind of deal. And so it's kind of like finding going a little bit longer here, knowing you haven't had any knee issues, plus you pedal a little toe down, so it's a little less stress. If I move the cleat back a little bit, it kind of shortens your knee a little bit on that side of it. But we need it to be there because we want your elbows underneath your shoulders. So it's this whole like knocking the dominoes down game, right? So it's just not just like yes or no. It's a tricky question.
I actually thought of one more thing that is across the board in terms of mountain bike versus road bike, as long as that mountain bike has rear suspension, is we have to accommodate for that saddle or for the suspension sag when we're adjusting the tilt on the saddle. So if you were to compare like what we would set you up on your road bike versus your mountain bike and just looking at it on level ground, the saddle on your mountain bike is going to be tipped down a lot more because when you sit on that saddle and that suspension sags, it's going to tip it back up. Yeah.
What do you recommend a good ratio of strength training to actual riding during the season so that you can ultimately avoid injuries?
Yeah, great question. So questions on like the ratio of strength training to riding. And I'd say like, so there's a principle in strength training and just training in general called periodization. So if we take strength training, for example, ideally in the off season, that's when you're putting the bulk of your efforts into your strength training. As your volume and intensity of riding are increasing, you're going to be pulling away a little bit from your strength training. So if you're strength training, let's say 3 or 4 days a week in the off season, as your season is progressing in season with cycling, you're going to be taking days away to where if you have like an A race, you may only be doing strength training 1 day a week as you're leading up to that A race. or a maximum of 2 days a week throughout the kind of within season.
Yeah, I would say, 4 days a week is a lot. Who are you working with? But no, most of my athletes, it's 2 days a week in the off season, and then it's a trend from 2 to 1. And in like the summer months when they're riding a lot and or racing, if we can get them to do one strength session every 10 days, it's a maintenance session. We just try to get them not to lose strength. But again, it goes to that, how much can we fill their bucket with stuff? And usually the lifts they're doing are high compound movements, squat, deadlift, and maybe one like overhead thing, but it's low volume, high intensity. It's all about like neuromuscular recruitment and not fatiguing the muscle really. So yeah, it's like Jason said, your timing is opposite for strength training as it is for training for biking. So I kind of always laugh when people are like January and they're strength training for ski season. I'm like, just setting yourself up for, yeah.
Yeah, also a lot of people will be worried about, if they decrease the frequency of what they're strength training during the season, that they're going to lose strength. And as AJ said, he's building, because AJ does coaching as well as a PT. I'm just a PT. I don't want to do coaching other than NICA, which is fun, but I don't want to like actually write training plans and things of that nature. There's been a lot of research looking at what's the minimum dose or what's the minimum frequency that you can strength train and not lose the gains that you've made from before. And it's really the real important thing is maintaining intensity of the training that you're doing. And it can be as little as, once a week or once every 10 days. And you can maintain that for many months without actually losing strength, provided that you're, still getting your diet dialed in with that too.
Okay, so now you open that door, AJ. We're here about biking, but those of us who are also skiers.
Yeah.
This is off season for skiing, and we're lifting for skiing, right? So we're dialing back lifting, we're riding. I get that, but so what, right? So squats, lunges, deadlifts. How does that work? Or how? And I'm not looking for a training plan.
Yeah.
How do you think about changing that orientation, away from cycling because we're now rolling up volume there, but thinking about, okay, now we've got a solid block of time before snow starts to fall again, and so let's start loading up that lifting volume for next season.
Mm-hmm. I from the coaching standpoint, my question would be like, what's the goal for the bike season? Because then I have to work backwards a little bit of like, we can do smaller periods of high intensity, low intensity, high volume, low volume, rather than just one big consistent thing in the summer. But the reality of it is the more activities you participate in, the harder it gets. And you can't go 100 on all of them. And that's the conversation I have with myself and with a lot of athletes all the time, right? And it will depend too on, again, age, your fitness level, what your goals are in skiing. But I would... I get where you're coming from. It's not an easy thing, but I would say you got to do both for a while. Yeah. It's hard to fit it all in. You're absolutely right. Yeah. I'd rather you probably be a little more tired on the bike and keep the lifting in place if you're just looking to ride for like enjoyment, maybe some bigger rides. Maybe say you have a weekend bike trip with some buddies, right? So maybe the week before you lift once, you give yourself a short little recovery break leading into a big trip or maybe an event. But then as soon as you're recovered, you bring it back up again. But yeah, it's kind of finding these sneaky little ways to keep it in and not just go to zero and balance it all. It's not fun from a coaching standpoint or an athlete standpoint because something's got to give.
In terms of pre and post ride stretching or routines for injury prevention, is there, maybe not routine so much, is there a better time to do it at the pre-ride, post-ride, length of time, a little bit of stretch, so there's flexibility?
Yeah,
you recommend?
great question. So, yeah, I will. So the question is pre-ride, post-ride, how in terms of trying to prevent injury or maybe even address some tightnesses that you have. when is the best time to stretch, and then how do you stretch. So there's been a lot of research looking at stretching too, and particularly from an injury preventative standpoint. And if you stretch before your event, so before your training or before you're hopping on the bike, at the very least, it's going to decrease your performance. It may actually, there's some weak evidence to show it may actually even lead to increased risk of injury if you're stretching before your routine. And then with that, we're talking about static stretching, right? So where you're sitting there, you're doing your quad stretch, holding for 30 seconds or more, that has been shown multiple times to decrease performance. And so really the answer that is doing it after is going to be best. And that's going to actually help with recovery too. Foam rolling sometimes in the sports medicine world can get poo-pooed, but I think that foam rolling is a great thing to do for recovery. There's some weak evidence to show it actually increases blood flow to the tissues that you're foam rolling, so it's flushing those tissues. And then I recommend that people, after they're done doing the foam rolling, if they have some tightnesses that they need to address, for cyclists, it's almost all hip flexors and quads, that you're doing your stretching afterwards. But the key is being consistent with it. Yeah. Compression. Like the pneumo things, if they feel great. I haven't seen any evidence to really support it for recovery.
So just you say doing stretches and activation before physical activity, like riding a bike or riding a long ride or planning something big on the weekend, decrease the performance?
If you're doing it like within 30 minutes of the activity with static stretching. Now that changes if we're talking about dynamic stretching, which is more the activation I think that you're alluding to. And so, the best thing you can do is just have a good proper warm up with that. So, as far as something where you may be feeling a stretch, but you're actually doing as a dynamic warm up would be something like a lunge where you're having to get that hip behind you and doing it that way versus doing your static stretch like that.
So depending on what kind of effort you're doing, because you see professional athletes, let's say mountain bike road, doing stretches X amount of time before, they go on a trainer for X amount of time to kind of wake up the body, wake up the muscle, and then go off at the start line, and they have between an hour and a half to 7 hours of racing to do.
Right.
Is that different? Is that like something that decreases performance?
So again, it's the amount of time that they're doing it before the event. So typically they're going to be on the trainer for more than a few minutes, right? They're going to be on there for a while, and they'll have done their stretches, at least a half hour before they're on the line. Yeah.
There you go.
Okay.
How do you know what strength training you should be doing? I mean, doesn't it? I mean, I don't do any, and I should.
Well, that's the first. Yeah, you have to do some.
Does it matter what they speak on you, or is it just every biker should be doing these ones?
What's the goal of the strength training?
Well, you're supposed to do it.
Yeah. No. I mean, that brings the question, right? Like, if you're coming into Jason Ryan, your knee hurts, right? Like,
It does.
yeah. So the intention of our strength training will probably differ a little bit than if, say, you made it through ski season, you're not bothering anything, and your goal is to improve your riding capacity and or performance on the bike. Ultimately, it will kind of blend and look the same, but our starting points of what the strength looks like will be different. I think there's a really cool saying out there is like, stronger people aren't only harder to kill, they're more useful. And so the reality of it is like any strength training you can find time to do is important. And for the bike, I would argue that a squat and a hinge movement, at least if you have time for two of those compound movements, I'd start there. But it really just becomes, again, how much time in the bucket, what do you have access to? What are you familiar with? What can we get you to do correctly? Is there something in your history that might have crept up that we can put in here so that it addresses maybe a kink in the armor per se? So, but if you're looking at like what do professional cyclists do? Knee extensions, squats, deadlifts, and maybe a little bit of hamstring work.
What's a hinge move?
That's a deadlift. Your hamstring.
Oh.
So like,
So with the picture of him with with the broom on his back up there. A ski pole actually works just as well. Most people have that. That's a hinge movement. So that is
More.
yeah. So it's what a deadlift is, but you can change or modify that movement. So if you're not familiar with doing deadlifts, we can do something called RDLs, which is basically a top-down deadlift, or we can make it more simpler to that. So you're building up to that. So you don't overcook it with the strength training, and then now you have maybe an injury or some soreness from the strength training that's preventing you from being on the bike.
Just to follow up to that recovery with a foam roller, sometimes there's like those fast massage pulsating ones, and then you have some that are just like they vibrate, like those old school grandma ones.
Yeah.
And they say that it increases vascularization, blood flow, and what do you think about that? It's is that all hocus pocus, or is that just because it feels so good when you're doing it? You're like, that's great.
So I'm not as familiar with the literature on the massage guns and things like that, but I would think that it would work the same way that a foam roller would, where you're just adding that compression, and again, it's pretty small scale studies, and if we're looking at the quality of the study of how well can we trust the results of the study, it's not that great in terms of what's there for foam rollers, but what is there does show some blood flow. So I think you could have, some increased blood flow with that, but that should be a pretty small part of your recovery process. The biggest thing is your nutrition, your hydration, and for sure sleep. AJ had mentioned about looking, the 2 to 3 weeks prior to you developing your pain and what your training history was. Also look at your sleep history and how well you're sleeping, because there's a lot of really cool, interesting data on that showing that regardless of the injury or the type of athletics that someone's doing, there is an increased elevated risk if someone has poor sleep 2 to 3 weeks before their event. You want to add on that?
Yeah, I think Jason nailed it. And when I talk to athletes and also, following a lot of that sports science research, especially in the recovery side of it, I mean, the massage guns, the BFR cuffs, the dry needling, it's all really sexy. People want that done to them. But like Jason mentioned, I mean, most professional athletes have that done to them because they're doing the other 95% of things that are important: the sleep, the hydration, the nutrition, the lifting. There's somebody's feeding them the right amount of grams of, spinach that day. Most of us are juggling how do I get to sleep on time, work stress, life stress? Can I even get an hour of exercise in? I can only lift one day a week. So while it's good and better than nothing, I wouldn't get too fixated on how long, how much, how hard, or if it's not going to fix anything. But if you've crossed all the other boxes out and you're sitting on the couch for 20 minutes watching, White Lotus, definitely not going to hurt you. So not bad, but don't get off the bike and be like, this is it. This is going to save me from X, Y, or Z. Yeah.
I study size of one, but I have some compression boots and I have little things and I've bought all into that stuff. But I do find, you mentioned sleep at night, it just helps you relax. If I have a late workout, if I got back and I'm off the bike at 8:30 and I'm trying to get back by 9:30, just sitting on the TV, massage gun or something like that, it might not do anything to the muscle, but it's just it's a very relaxing routine.
Yeah, and then it has a huge effect then, because again, sleep, as far as recovery, sleep's the most important thing. Exactly.
Yeah.
And even better, if you believe it's going to help you, it's going to help you. You're going to manifest it. So
The body and stuff like
Yeah.
that. Maybe some is hocus pocus, maybe some not. But
Yeah.
if it makes you feel good and you're happy, it's about all.
Okay, Jim, you've been waiting a long time now to ask your question. Yeah.
I'm struggling to phrase this the question.
We both worked with Matt Madsen, so you can ask it however you want.
Oh, okay, oh, there you go. So I'll tell you my experience and tell me if you think I am completely wrong or if this makes sense to you. I noticed foot position is one of the key things, where you begin. And, for years and years and years, road was cycling cleats, even before clip. I understand what clipless means because
Because you had clips, right?
Yeah. Because foot's locked in, or still pretty locked in. And over time, and as I've gotten less performance oriented and more just kind of clunking around on the bike, I'm now 100% on platform pedals. And my perception is there's maybe some value in the fact that you're not exactly on the pedal in exactly the same way every day. And does that make sense to you, or would you see, is it better like, oh no, we want to the millimeter right there every time, no matter what?
No, I mean, so there is value in you being able to, I generally like slightly move your foot position, and that's where like pedal float really comes into play on clipless pedals too. But yeah, anytime you're in one position for too long, it's stressing certain areas of your muscle, bone, tendon, nerve. And so that cumulative stress is going to increase, especially if you're not giving your body the time to adapt to that stress. So just by changing your foot position, it's going to change where that stress is being applied. So it will benefit it from that aspect.
So there's potentially.
But it may not be as well a big of a performance,
Depends on the goal. What do you mean by
Yeah.
value?
I mean, staying, healthy, injury free, and just feeling good. Is there potential?
I would do whatever
benefit
one
to
is
allowing-
you want.
Yeah.
Yeah.
So yeah, being able to change your foot on the pedal is going to help with that. Yeah, as long as you're not like putting your heel on the front of you're not doing something weird. Yeah.
It's not crazy. It's not crazy talk to
No.
ride.
I mean, and
to move it around one day it's all here.
common misconception too is like when those guys are in Peloton for 7 hours, they're not buckled in. Their shoes are pretty loose the entire time until they don't need them to be.
Yeah.
And that's why the advent of the BOA strap is huge, is because you'll see them go into like, we're in the classic season. So right before they jump into the cobbles, they're there. And then when they're out there and they can wiggle and move their foot around. So don't feel like you need to just strap it down and leave it there. I mean, I think that's a big thing, especially when I work with people at foot pain. It's like, well, give yourself a little. I mean, it's actually kind of nice that you don't really lose much because you don't pull as much as you think on the pedal. In fact, no professional cyclist does anything on the pull stroke. It's all push. And so that aspect of needing that lockdown is.
Yeah, I mean, if we were to switch to platforms, it was kind of like embarrassing. I didn't want to tell people, but it's like, I don't think I'm really losing anything.
Yeah.
Because I'm just not.
I think I see more. I guess I see injuries in both of them. A lot of people, especially mountain biking on platforms, will bounce off the pedal, but a lot of people will slide out and can't get out fast enough. So it's a little bit of a personal skill preference too.
Yeah. Good question. What further questions do you have?
Tomorrow.
AJ actually probably does.
Yeah.
He doesn't normally work on Fridays, and he put in a Friday, and yeah.
But it's probably
In the afternoon.
1:30.
Yeah. Cool.
Unless it's a tri-bike, then I don't.
Well, I'd really like to thank Dan and Uphill for inviting us to come and provide this space for us. And Nelson and Swimba, and to come and talk about the exciting trail that's going into Bridger. This is a free event, but we really do try to use these events to help highlight other nonprofits around the valley. And if you feel so inclined, please help support Dirt Concern and Swimba. It goes a long ways, and Bozeman's growing, so we need more trails, so it's not as crowded.
And a gondola. I'm just kidding.
Yeah.
Thank you.
Thank you.